The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go to Health Media with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. You can visit and subscribe to the show at gotohealthmedia.com. And now, here is Jonathan Marks. Hey everyone, this is Jonathan Marks. Welcome back to another show of Go to Health Media. Please join us each week and subscribe. You go to gotohealthmedia.com and then press the button that says subscribe or update, and you can join us for more shows. So today we're talking about Medicaid, and if you know people who have Medicaid or you're on Medicaid, listen up because there are a lot of big changes coming in 2025. Medicaid covers 1/5 of the U.S. population. That's 72 million Americans. And 31 million of those Americans are children. That's 43%. We've seen articles in many news sources that say the incoming GOP Congress intends to cut Medicaid. Medicaid plays a larger role in providing health coverage to people living in small towns and rural communities than it does in metropolitan areas, a trend that is particularly striking among children, according to the extensive analysis by the Georgetown University Center for Children and Families, that's CCF, and the University of North Carolina Rural Health Research Program. A Georgetown University report found that non-elderly adults and children in rural areas and small towns are more likely than those living in metro areas to rely on Medicaid for their health insurance. As a consequence, reductions in Medicaid funding being contemplated in Congress are more likely to cause greater harm to these communities than in metro areas. This report corroborates a video series we did at Go to Health late in 2024 on how Project 2025 will change healthcare in the United States. And one of those videos was on how Project 2025 would negatively affect healthcare in rural areas. So with us to talk about this more today is Joan Alker, the Executive Director and Co-founder of the Center for Children and Families, that's CCF, and a research professor at the Georgetown University McCourt School of Public Policy. She is a nationally recognized expert on Medicaid and the Children's Health Insurance Program, that's CHIP, and is the lead author of CCF's annual report on children's health care coverage trends. You can learn more about this topic, and we'll repeat this, at CCF, that's the Center for Children and Families, ccf.georgetown.edu. Welcome to the show, Joan. How are you today?
I'm doing great. Thanks for having me, Jonathan.
Good. So you did this big study about Medicaid in rural areas. What are the overall findings of the study?
Yeah, so we looked at data for every county in America, and what we
Wow.
found is that families and adults in small towns and rural areas are more likely than those living in metro areas to rely on Medicaid for their health insurance. And this is, I think, surprising to some people. We've seen this pattern before, but we wanted to go ahead and check that again because there's been a lot of things happening in Medicaid.
Mm-hmm.
But I think one thing that's really important for your listeners, Medicaid gets far less attention in our national discourse about healthcare than some of the other aspects of publicly funded healthcare, namely Medicare and the Affordable Care Act marketplaces. But in fact, Medicaid is covering more people than Medicare and far more people than those ACA marketplaces. So Medicaid is really operating throughout the lifespan of folks in this country. It is the largest payer of births. It covers 40 to 50% of all children in most states.
Wow.
And it covers low-income adults, and it also covers the majority of people in nursing homes and long-term care. So Medicaid is playing many, many roles in our healthcare system.
So let's talk a little bit about what healthcare is like in rural areas. What are the challenges that people have?
That's right. So there are a number of extra challenges that rural communities face. First of all, rural communities tend to be poorer, and they also tend to have more chronic health conditions.
Hmm.
So that's one side of the ledger. On the other side, rural communities are suffering from greater provider shortages. And we've also seen a trend in the last 10, 20 years where we're seeing more closures of hospitals in rural areas as
Yes.
relative to urban areas. One aspect that's been particularly acute is the loss of birthing centers and hospitals. So, care for women that are pregnant and then when they give birth, that's been a real growing problem for rural communities.
And I would also imagine there's a shortage of specialists in rural areas. So maybe you have to travel 50 miles to see a general practitioner, but then you have to be referred to a specialist somewhere else. Can you tell us more about that?
Yeah, that's absolutely right. I mean, we have a lot of problems for folks across the board in our healthcare system accessing specialty care, particularly certain kinds of specialty care. But those problems are more acute in rural areas. And sometimes, we hear of children who live in rural states. They have to go to another state, for example, if they have cancer and other kinds of relatively rare, but conditions that sadly do affect children.
Got it. And so what do we know? I know this is all in discussion in Congress, but what do we know about the threats to Medicaid funding from this 2025 Congress?
That's right. Well, Congress is moving rapidly to pass a big bill with a lot of the new President Trump and the leaders in Congress' top priorities. And those include extending tax cuts, which, of course, will primarily benefit the wealthy, disproportionately benefit the wealthy, I should say. What we didn't know, but we fear this might be the case, is that Medicaid is a top target for cuts. There were some documents leaked last week by key House Republicans identifying Medicaid as the number one source of cuts for these other priorities. And this math may be a little fuzzy, but what the House Budget Committee chair put out was in fact 2.3 trillion with a T cuts in Medicaid
Wow.
that he thought Congress should move forward on. So this would devastate the Medicaid program, would be especially harmful for rural communities, which are already suffering and rely on Medicaid at higher rates, as we found in this data.
Right. And as I mentioned in the introduction, we did a series on how Project 2025 will affect healthcare in the United States. And healthcare in rural areas was definitely one of the topics there where there was going to be a problem because of reduction in funding, not only of Medicaid, but also to state healthcare departments. Reduction in funding to state healthcare would also cause a problem as well. So what is the difference in Medicaid coverage in rural areas versus metropolitan areas? Is there a difference in coverage itself?
So there shouldn't be a difference in the coverage, eligibility, or benefits,
Hmm.
but there are two things I would point out. One is that because rural areas tend to be, in a lot of cases, lower income than metro areas, you do see greater number of folks who are eligible. And what we found in this report is that in 6 states, and I'll name those states, New Mexico, Louisiana, Arizona, Florida, South Carolina, and Arkansas, that over half of children living in small town and rural areas are covered by Medicaid. And that's reflecting, again, the lower incomes in these rural areas. But then on the flip side of that, you have provider shortages and rural hospitals operating on very tight margins. So if Congress were to go ahead with these large cuts, this would be devastating because states really can't manage their way out of such large cuts. They simply could not raise taxes enough to make up for these large cuts. And beyond that, they only have a few ways to handle this, right? They either have to cut provider rates or they have to cut benefits or people off.
Hmm.
So providers who are already operating in very thin margins, particularly these rural hospitals and birthing facilities are going to be in deep trouble.
Wow. And now, what does this mean for children? I mean, the healthcare of children. I usually think of health, oh, kids are sturdy, they're healthy. I mean, I know that's not true, but what do these cuts mean for the healthcare for children in these areas?
Yeah, so 40 to 50% of children in the United States are covered by Medicaid. So any cuts of this magnitude to Medicaid, any large cuts, even cuts in the hundreds of billions of dollars, even if they're not directly targeted at children, they will have a negative impact on children.
Mhm.
Children are not expensive to cover. By and large, they're relatively healthy. However, they do need regular care. And I know as a parent, when my kids were little, I was constantly taking them to the pediatrician.
Sure.
Sometimes we had to run to the emergency room because, my daughter hit her head on the radiator, needed stitches. They injured themselves playing soccer. And kids have chronic conditions like asthma. Of course, we have behavioral health challenges, particularly adolescents are facing. So kids have real healthcare needs. They're not expensive, and it's a very wise investment of our tax dollars because
Hmm.
we know that a healthier child will do better in school. And there's a lot of research to support what a wise investment it is to cover children with Medicaid. It helps the taxpayers in the long run because the children are healthier. They succeed better in school educational outcomes and pay more taxes as adults.
Got it. So if people want to learn more, I have a website here and I just want to repeat that for us. It's ccf.georgetown.edu. ccf.georgetown.edu. And what will people learn when they go there?
Well, we have a lot of materials. This new report has county data for every state and county in the country. You can see, look up your community, see how many folks are covered by Medicaid. We also have an active blog, and we're keeping track of the congressional debate.
Hmm.
So if you'd like to keep track of the congressional debate on what they're saying and doing about Medicaid, our blog is a great resource to tune into.
Got it. And I also wanted to ask about Native Americans and Alaska Native residents and of tribal lands. How are they going to be affected by this?
Yeah, I'm so glad you brought that up. One of the things that really popped in our data was how important Medicaid is as a coverage source for American Indian Alaska Natives, particularly for seniors. And this was really an eye-opener. When you look at the overlap of some of the counties and tribal lands, you find that as many as two-thirds of seniors, for example, on the Pine Ridge Reservation, South Dakota, are actually being covered by Medicaid.
Hmm.
We think of seniors being covered by Medicare, but low-income seniors are covered by Medicaid as well. And so this really is absolutely critical for these indigenous groups, and cuts would have a very devastating impact on a very vulnerable population.
Got it. Are there things we can do to lend our voices to what we feel about this? Do you have recommendations for that, or are those recommendations on your website?
Well, we don't lobby, so we don't have any kind of mapping you in to Congress. That's not what we do, but we have a lot of information for you to use there as you talk to your representatives. We do have data actually on Medicaid coverage by congressional district,
Oh, good.
but I really encourage folks to educate themselves and talk to their members of Congress because this is the issue we run up against time and time again with Medicaid is that it's sort of the sleeping silent giant in the debate. And even though it's covering almost 80 million people, more people than Medicare, far more people than the ACA marketplaces, it doesn't get talked about enough. And yet it's so vital. So we encourage everybody to learn. Pretty much everybody knows somebody who has Medicaid coverage, but talk to your representatives, lead discussions in your community about this because this isn't popular. Voters of all political stripes support Medicaid, and that's very clear in poll after poll. So we need to ensure that this doesn't happen quickly and quietly.
Good. Thank you so much for being with us today, Joan. It's been really nice talking with you and learning more about this. We've been talking with Joan Alker, the executive director and co-founder of the Center for Children and Families, that's CCF, and a research professor at the Georgetown University McCourt School of Public Policy. We've been talking today about potential cuts in Medicaid and how it will affect rural areas. Thanks so much for being with us today, Joan.
Thanks so much for having me. Thanks so much for covering this.
Good. And remember, if you want to learn more, you can go to ccf.georgetown.edu. This has been Jonathan Marks with Go to Health Media. And as we say at the end of every show, go to health. See you next time. Take care. Thank you for tuning in this week to Go to Health Media. Be sure to join Jonathan Marks and another health expert next time. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.